in the country on the 5th of March. The third case among the three that I have now mentioned involves a Burundian national who had traveled from Dubai to Kenya, arriving on the 17th of March 2020, and this one was picked by our surveillance team with high temperature during routine screening at the Jomo Kenyatta International Airport. And that establishes, I think, what we have been saying all along. We are able to screen, and we are able to pick, and we are able to determine. So this one was a case in point, an establishment of that fact. So what we are doing now is that tracing of persons who may have come into contact with these patients is now ongoing. 18 cases are currently admitted at Bagathi Isolation Center. 7 others have been screened out and are negative. Samples from the remaining 11 suspected cases are currently being processed in our 2 designated laboratories. The 7 who tested negative are being processed for discharge to continue self-quarantine at home under close supervision of the Ministry of Health staff, collaborating with the country surveillance teams. I want at this juncture to make a special appeal to Kenyans who are traveling from outside the country. It is now clear that the threat that we face, first and foremost, is the threat from Kenyans who are coming from overseas, or Kenyans who have visited overseas countries. And that is why we had said that Kenyans who are coming in must self-quarantine. And we are happy to say that a lot of people have complied. But at this juncture, we also want to appeal to the general public that if you know that an individual who has agreed to self-quarantine and you can see them not self-quarantining, please report them to our toll-free number, 719, and let me remind such people that it is an offense punishable by a jail term for you to say that you are going to self-quarantine and you do not. And effective today, any Kenyan who is traveling from outside the country must sign a legal form at the airport, must sign a legal form to confirm that they are going to self-quarantine themselves, which gives us the instrument to actually jail you if you do not follow the procedure. If you do not, and the public pronounces you as such, and it is proved as such, we will then take you, self-quarantine you forcibly for 14 days, and then charge you in a court of law. We continue to improve our preparedness for the disease. Today, for the first time, via a video conferencing capacity which we have just installed today, our doctors were able to carry out a video conference with Chinese doctors. The ones who have been handling the disease in Wuhan were able today to talk on a one-to-one, not only with the Kenyan doctors, but also with about 20 countries. We were in a video conference, all of us, with 20 African countries. This is an extremely important step in terms of knowledge share, and they gave us tremendous amount of knowledge, which we believe will also go a long way into assisting our people. And when we talk about self-quarantine, at one time 1.4 billion Chinese were self-quarantining. In Wuhan alone, there was a forcible quarantine of about 60 million people. So let's put things in perspective and tell our citizens that if those people can do it, why can't we infuse discipline within ourselves and do the same?